So a lot of people think breast augmentation is just about going bigger, but there's way more to it than that. From choosing the right size to knowing what recovery is really like, there's a lot that patients wish they knew before surgery. So in this video, we're going to answer the most common questions, plus a few things you probably didn't even think to ask. So the first question is, what is breast augmentation?
Yeah, so breast augmentation is a cosmetic procedure designed to enhance the size, shape, fullness, and cleavage of the breast, typically using implants or fat transfer. It's one of the most customizable surgeries that we offer because it's not just about volume and size, it's about creating balance and harmony with the body.
So what types of implants are available?
So the two main types are saline and silicone. Silicone is the more common type of implant because it tends to feel more natural, it sits more naturally in the chest. Saline implants can be more easily adjusted during surgery in terms of size. The best choice really depends on your anatomy, lifestyle, aesthetic goals, and we help guide patients during those decisions. So what are some reasons that people decide to proceed with breast augmentation?
A lot of reasons. Some patients, they want to restore volume after pregnancy or weight loss. Others want to correct some kind of asymmetry. And many just want to feel more confident in their bodies. Everyone's motivation is different and valid.
What is recovery after a breast augmentation like?
Well, you're likely going to feel sore and tight in the chest for the first few days, but it will be manageable. Most people are back to work within a week and can ease back into exercise after about 4 to 6 weeks.
Of course, it depends on your activity. If you're planning to rock climb, that's probably not going to happen in the first month, maybe.
We'll guide you through everything, through the healing process, and keep everything on track for you. So what are some of the risks or side effects of breast augmentation?
Yeah, so some risks are bleeding or hematoma under the skin, infection, changes to sensation in the nipple or the surrounding chest skin, or capsular contracture, which is where scar tissue forms tightly around the implant. That can happen shortly after surgery or longer term. But with that being said, the risks are fairly low. With careful planning and a qualified surgeon, all of those risks are pretty minimal, and we're there to guide you to help you stay fully informed. So how long do implants last?
Well, implants aren't lifetime devices, but many last for well over a decade. We do recommend periodic monitoring, especially with silicone implants, and generally replacement is only considered if there's a complication or if someone wants to change their size or shape down the road. Well, I think looking as natural as possible, it's really going to be dependent upon choosing the right implant size that fits your body. So implants have 3 dimensions in the X, Y, and Z, and we measure these numbers, and there's different types of implants that will fit differently depending upon the X, Y, and Z measurements on your individual chest. And so you can start to push the envelope a little bit with those numbers, and that's where you can kind of get into this unnatural appearing look.
Right. Yeah, agree. And I think the word natural, I always want to really define what that means, because kind of like what you have now may be natural, but in comparison to what? Is it in comparison to what you used to look like, or kind of an idealistic version of what you desire? So, natural can mean different things to different patients, just kind of like cup size, where it's not, standardized metric. We can't guarantee a cup size. There will be subtle asymmetries after all breast surgeries. But it's important to understand what natural means to a patient as well. A lot of times we get photos of celebrities or a friend, and they're like, well, look at this looks amazing, and it looks so natural. And it's like, well, the implants are way high, or they have capsular contraction, like tight scar tissue around their implant. To that patient, that looks great, but it's not necessarily a natural look. So we really have to help define what does natural mean.
Right, so if you can articulate in a photo what it actually is that you like specifically, it helps us understand your goals a lot better.
Yeah.
So if you're considering surgery, make sure you're working with someone who listens, educates, has experience, and helps make the best choices for you. Call us at 212-427-3982 or visit breastsurgerygroup.com to schedule your consultation.